about it.
All right. All right, so we're here with May and Letitia from Lotus Health Foundation, and they're going to talk about their upcoming Community of Wellness event. So be sure to leave your questions in the comments, and they will answer them during the video and definitely at the end. All right, so now we'll turn it over to them. We'll get you situated here. Awesome. So yeah, if you ladies both want to introduce yourselves.
Hi, my name is May. I am the founder of Lotus Health Foundation.
Hi, my name is Letitia Calise, and I'm a certified clinical aromatherapist at Rochester Clinic.
So probably the best way to start out is to talk a little bit about Lotus Health Foundation. So what is it, and what is the purpose of this nonprofit?
Lotus Health Foundation is a 501c3 nonprofit organization, and its mission is to provide the evidence-based lifestyle medicine education to the public, empower people to adopt a healthy lifestyle. So we get to be healthier and not to rely on too much of medications. So that's our mission.
So you have your community wellness event coming up soon. So do you want to talk a little about that? Talk about when it is, what mission you want to accomplish with the symposium, and kind of more details about that event.
Sure. When we established the nonprofit Lotus Health Foundation, the purpose is how we be able to provide this lifestyle medicine education to a broader audience instead of just one-on-one. And especially in Homestead County, there are more than 67% of the adults are considered obesity, and 23% of the residents actually take more than 2 of the medications, and 13% of the population have the diabetes conditions. So it is a huge issue, and that's why in 2016, when we received a small funding, we we start with this concept, and we host a community-wide lifestyle medicine event, and we call that as a community of wellness symposium and also a gala. So we have 2 major events together in this 1 week. And in this coming March, our symposium will be hosted on March 21st and 22nd at 125 Live, and the gala will be hosted on March 22nd evening at the Rochester Golf and Country Club.
So for someone who wants to attend the community and wellness event, the symposium and the gala, what kind of specific type of lifestyle medicine programming would they expect to take place at the symposium this year?
Okay, so the lifestyle medicine actually is, cover a whole spectrum of the health components, such as nutrition, the exercise, stress management, how to, even sleep, and also healthy social connections. So we want the healthcare providers and also the general public come to this event to learn about the tips and how they can even help, be able to help other people. So the symposium this year, that we have the 2 keynote speakers, Dr. Neil Barnard, and he's the president of the PCRM, Dr. Neil Netley, also specializing in lifestyle medicine to treat the anxiety and depression. And that's one of the highlights we are going to focus on, which is to address the mental wellness, especially emotional health. So people are interested in coming to learn more about that. They can come to the Rochester Clinic or Lotus Health Foundation's website and go to the special event. You'll be to see the whole spectrum of the schedule.
So my understanding, at least, was that this was the first year that mental health programming was added to the Community Wellness Symposium. So why was it important to your mission to add this programming into your event this year?
Okay, so in the past 2 years, we actually have to talk about the how the lifestyle medicine affect the chronic disease, and until recently I have been approached by several organizations and mentioned about it's a huge concern of the anxiety, depression, and even addiction. And another things, probably we don't realize that how stressful it is. We live in the current fast-paced environment at work, or we have been wearing so many hats. So we gradually add a lot more stress on ourselves, and finally one day we probably just cannot handle it anymore. And so a lot of people, they actually don't want to be diagnosed or crown the head of you have a mental issues, and actually many things that we can help ourselves to manage it by using a different approach, like I mentioned, the nutrition or the way to manage the stress, such as could be the aromatherapy, yoga, practice yoga, or meditation. So I also found out that since I'm also a CHIP, this Complete Health Improvement Program facilitator, and for past 4 years I have been facilitate about 18 groups, and it's close to 200 attendees. They have expressed a huge stress, even though they are retired. Some people, they are retired, they're still very stressful. And I realized that that's such a key component to help people really overcome it and become a true health. So it's very important to be part of it. And by the way, Letitia probably will, she will be share with everybody how stress actually affect our body health, and we shouldn't ignore it.
Right. All right. I think when I initially thought about mental health, even just like 5 years ago, I think about mental health, and I think that it has to do with a medically diagnosed condition. And actually, mental health is far from that. It can be in some areas where there is a need for medical intervention, but I think about mental health, it really refers to how we think, how we feel, how we behave, and how we contribute to society. Are we able to do that? And when we are just bombarded with stress, it really limits our ability to contribute to society. It even limits our ability to be available as a parent, as a mom, as a friend. A lot of people, I see a rise in depression and anxiety, like May was talking about. I'd say probably 90% of the people that I meet with for aromatherapy care, stress is their top need. Like if I sit down and I say, what are the top 3 things that you would like to work on? The top is always stress. And I honestly, if you look at the research out there, a lot of times what we go to the doctor for are stress related. They are either caused by stress or enhanced by stress or worsened by stress. So if we think about stress and how it affects our body, it affects our physical health, it affects our emotional health. When we are in acute phase of stress, no big deal, right? We're just trying to survive. We need to get out of an emergency situation in order to survive. So in that time, our digestive system kind of shuts down, our immune system shuts down. We don't need that to survive for the next 90 minutes. But when we stay in that state of acute stress, and we don't allow our bodies to go back into the rest and digest, that's when we start to experience problems like our digestive system isn't working. All of a sudden, you got that nausea and you're just like not feeling well, and your immune system, so you're more prone to catching colds or flus or other kind of sicknesses. Somebody could breathe on you and all of a sudden you're sick. So what does that relate to with productivity in the workplace? Well, that shuts you down. You can't focus, you can't work as productively as you should or could. So your contributions to the workplace are therefore, shortened, or you aren't able to produce as well as you could at home. You're not able to be available for your children or whatever you are involved with in the community. So we think about mental health. There are so many different topics that everybody in the community can find something, a lot of gold nuggets out of there. Topics like gut health, and you think, how does that have to do? What does that have to do with my mental health? Well, there's a brain and gut connection, and so that definitely is something you'd want to listen to. Also, women's health. and
Yes.
the stress.
Yeah.
That's very, very important, and how we're
Mhm.
balancing all that. And there's also aromatherapy, of course, that's my favorite, and I talk a little bit about stress and also brain health and how you can work on focus, relaxation, and things like that to help you be more productive. Power foods for the brain,
Yes.
sleep, Alzheimer's, all of these topics that are just, so prevalent in our community and also outside of Rochester as well. So this is good information that you can learn to, help yourself and therefore help others around in your community as well.
And the theme of 2019's Community of Wellness is community connections, resilience, and happiness. So if we can connect all the dots together, even the community organizations to work together, become the very good resources to people who need help. We can even become a stronger, healthier community. And thank you, Leticia, for mentioning about some of the highlights of our programming. But I would like to kind of break down the symposium into 4 separate sections. On day 1, March 21st, Dr. Neil Barnard actually going to kick off the symposium to highlight how lifestyle medicine actually incorporate the general health, and we will introduce the gut health, women's health, and even environmental health. How the dirt actually affect our health as well. In the afternoon, it's more focused on employees' wellness, and as Natisha mentioned, the productivity is important. And we found out that more than 75% of the office doctors visit related to the stress. And if ourselves or employees are stressful at work, then the productivity will be dropped. So that's very important to address at the working environment. Also, for smaller employers or nonprofit organization, I have heard that constantly they struggle with the very expensive health insurance. And at this point in Rochester, just not many choices. You are paying a lot more premium, but you also deal with a lot higher of the deductible. So we are going to invite the experts to come to talk to us. What are the options like cost sharing plan? So help us to reduce the cost, but also we can afford a lot more classes like distress, use the aromatherapy to distress the employees, and also some yoga classes or meditations that to enrich the wellness program. On day 2, March 22nd in the morning, Dr. Neil Netley will start the day with the emotional health. It's called intelligent the emotional intelligent health. And then Dr. Barnard will talk about the healthy food for the brain, and we will talk about how to distress. And actually, Leticia, you are going to pair with Dr. Lear, the psychiatrist from Mayo Clinic. And so in the morning, we all cover about the mental wellness. In the afternoon, we will have several good resources representatives come to share what they can do for the community. It's like a resource roundtable. So it's a very well-rounded. In the evening, we will close the symposium with a nice gala event. We will feature the 2 guest speakers, Dr. Neil Netley and Dr. Barnard. Especially Dr. Neely will talk about the awareness of the suicide related to anxiety and depression. And Dr. Barnard will mention that how we adopt the healthy eating in the current environment. Of course, this event will feature 4 delicious gourmet whole food plant-based meal. And I just came from the Rochester Golf and Country Club, where is the place we're going to host this event. The chef has done fantastic job. I cannot wait to publish the teaser. The meal just wonderful. So hopefully that you all can come to register as soon as possible, because last year we actually sold out the ticket, and we only have a couple seats left for this year.
That's amazing. That's awesome. So this is the third year?
Third year. This
Third
is
year.
the third year. Yes.
Awesome.
And so this year we will have 280 seats at the gala. By the way, we will conduct the silent auction at the gala to raise a lifestyle medicine education fund. So there are several physicians from Rochester Clinic and also healthcare providers such as Letitia actually come out to community to offer free education to the community, and we also do the cooking demonstration at a Rochester Library. So we do need the funding to help us to continue to promote this education.
So do you want to talk a little bit about who should attend?
So I would say, Letitia, what do you think?
Well, I'm going to be honest here. I kind of think that everybody in our community should be there. If you are watching or you know someone who could benefit from cognitive, behavioral, emotional health, I want to invite employers, entrepreneurs, anybody who is in a high-stress position, doctors, nurses. I communicate a lot with doctors and nurses, and my heart goes out to them because we need them. We need them.
Yes.
And they need to be taken care of as well. And so if you can make it out here, I'd say caregivers, homemakers, moms who are home with their kids, moms and dads who may be overwhelmed or experiencing, maybe even borderline, like you're not so sure, you could be falling into depression, a little anxiety, maybe you don't really want to talk about it. This is a great place to gather information, to be exposed to healthcare providers who are here to educate, who are here because they're passionate and they care about your health and wellness, really enforcing self-care. I would invite those who are retired. We talked about people who are retired that are really stressed. I really want to say the entire community. Last year, I have to be honest, I didn't get to make it to the symposium. I got to go to the gala, and wow, I was amazed. And even in that time, the information that I gathered, I took that home and then added it to my stress therapy research paper, because I picked up some amazing methods just from that gala. And it was amazing. So I took that and then enhanced it with aromatherapy because I thought they were powerful, very useful techniques. So even if you can only make it to the gala or only make it to bits and pieces of the symposium, I highly recommend come get what you can, even if it's on your lunch break at work. Come and get some education and some care. So I hope I answered the question. I'd say everybody really needs to be there, but specifically, if you know you're high stress, maybe you're not aware that you're experiencing stress, starting to see some signs like your achy joints or tension in the neck and shoulders, little things like that. Say, you know what? I need a lifestyle change. And I don't know how to do it. What is this lifestyle medicine all about? I have no clue. Come and find out.
There's another, another thing I experienced and also watched it, so many people, the pattern of the life. We spend 2/3 of our life in accumulating wealth. However, how many of us actually spend the rest of our life to spend the wealth on our health? So think about, if you accumulate wealth, we gotta have a good health to spend it, to enjoy it. And also, we want to be there, be strong to support our family, and also we want to be around with our grandkids. And that's so important. It's a purpose, it's one of the pillars right here. Another thing I want to highlight is education is a power. So we talk about the health disparity, and we talk about some people who really don't know how to get well, or they are overwhelmed with diabetes, overweight. And unfortunately, right now in this society, there are so many noises out there, and people don't know who they should trust and what information they should gather. So they have been trying this and trying that and end up with helpless. And that's the reason Lotus Health Foundation stands strong right here. We try to bring the world-class presenters, come from Washington, D.C., come from all over the place, to here to educate our community, but also they go to Mayo Clinic to conduct the grand round, to speak with the physician, to talk to the medical students, and also the family medicine residents with many like-minded male physicians, which I truly kudos their dedication. So I am so grateful that we have become a stronger connection to help a lot more people. And so that's the purpose of the education. And as the last year during the gala, I don't know whether you remember I mentioned education, education, education. I cannot emphasize more than enough that as long as we have that piece of information, we all are very capable to help ourselves conduct self-care. So please join us. You shouldn't miss it because this is a lot of effort and a lot of hours contributed by many healthcare providers from Rochester Clinic, from Mayo Clinic, and from local community. Winona State University help us host this, and they will issue the CEU credits for some qualified professionals. So it's very affordable, and you are not able to find any conference with this kind of prize and to get to meet the superstar in lifestyle medicine.
Mm-hmm. So how do people register? How do they find tickets? Where's the best place for them to go?
The best place to find a ticket is you can go on Eventbrite, but my suggestion is to go to lotushealthfoundation.org, and you click on the event page. You'll be able to see you're on the event page to see the register either for symposium or for the gala. Or just simply pick up the phone, call me at 507-218-3095. Again, 507-218-3095. Or just simply send me a message. We will help you even reach us on the phone.
So I have some questions for you. I was kind of sketching them out here, so hopefully it makes sense. But no, I think it's so powerful what you both said, even about the value of creating an inclusive and healthy society here in Rochester, even if we just look down on that level, because I completely agree, and we're seeing the effects of that when mental health 100% affects productivity, and when those people can't fully contribute all of their capacity to our community, we're all suffering.
Right.
And that innovation is left off the table. So I thought it was really powerful when you said 70% of healthcare visits are related to stress.
Right.
I thought I pulled a number up a while ago that said mental health related conditions cost 40% to the bottom line of a business, but I'm not sure. Do you have any numbers
and
around
that?
I
don't have specific numbers, but I do remember looking up that actually because I was doing my research paper, and I was actually pretty amazed that at the bottom line, like employers, how much money they're losing because of the lack of productivity, absenteeism in the office, and I can't tell you a number for sure, but that's probably very close to it. But that's just to give you just an idea of how much is how much is
70% of healthcare visits are related to. I mean, I
stress related.
Well, like you were saying, like our whole body system is connected. So gut health, 100%. I
and agreeing with that.
I agree. Yeah.
And really that's what drove me into researching stress and stress awareness, was because I suffered myself from stress, and I have 6 children, and so I know firsthand. That's why I say moms, it's so important to be there, because if we are constantly pouring out of our pitchers and not filling it, where are we getting the fuel from? We can't pour out of an empty pitcher. So this is where all this education comes in, because we can then fill our pitcher. We could fill our pitcher with nutrition, with sleep, with good cognitive health. That way we can pour that out into our families, into our work, into our community. And so I kind of use that a lot with my clients, because that just helps them visualize, how are you pouring out of an empty pitcher? And that's really what stress does to our body. We're just not aware of it. And that's where I was not aware of it. And it was just, wow. I woke up one day and realized, I can't believe it.
Actually, I do have a report here.
Great.
Yeah. So right here, it says the poor health cost employees 576 billion a year. And this source is from Integrated Benefits Institutes from 2012. 40% of the spending is on the medical and pharmacy, and 40% is on lost productivity. And that's just how you are right. Also, here's a report from the workforce. It is a source from Kessler's HPQ adjusted to the workforce 2010. It is said the top 3 reason for employees to lost the work time is number 1, sleep disorders, number 2, depression, number 3 is fatigue. So
All stress related.
yep, and it's all stress related. So yes, this is a hard number.
It's incredible when you think about it.
Yeah.
Have you seen the conversation around mental health change at all over the past couple of years? Has it, in what people are talking about in your experience, or are people more open or less open, or you see no change?
I think that we have, just from my hosting the CHIP education experience, and also sharing with our physician from Rochester Clinic, I found out that the stress is everywhere. Especially when now everything is pretty much on multimedia. Even the teenagers and the young adult, they experience the stress, peer pressure. Everything is under the sun. And I just have one young girl, teenage girl, that shared with me that it's unfortunately that one of the classmates at a high school actually committed suicide because of the depression. And this, I have heard so many cases like that, and I think that now a lot more people, they actually open to the discussion, but also kind of start at a younger and younger age. So it's truly a big concern, and we really need to rejuvenate ourselves and how we prepare for that, and how we truly build our own confidence to really bring on our strengths, and not just to compare the other kids or other people. Especially when we raise our kids, they come back to school and say, well, so and so do this and that. I think that is very stressful to parents as well.
Absolutely, and I agree with May. I just recently had a story being told about a teenager who committed suicide as well, and so I feel like that's kind of on the forefront of my mind too, because that just really is pulling at my heartstrings, and I feel as well, and it might be the community that I work with as well, but there definitely is a rise in the depression, definitely a rise in the anxiety, a lot of the comparison and the social media, and just being bombarded by, this is the way life should be, and this is the way I fit into it. And so I feel like we're dealing a lot with that, and I think having providers that are open to self-care and lifestyle medicine approaches, and even natural alternative approaches, can give you that, stepping stone to identify, how can I take care of myself on a daily basis, and then also have your, interventions if needed. But I really do feel like it's on the rise, and that I feel like those who have come to us in our community and have been very open with it, and that I appreciate, because that makes our job a lot easier when we're trying to support them on their wellness journey, for sure.
Yeah.
And I wanted to ask you, that was another question, a little bit more about, so Lotus Health Foundation and Rochester Clinic are about more alternative medicine choices, so not, reducing dependency on a lot of medications. So can you talk a little bit about that in terms of maybe what's offered throughout this symposium and what you're doing with aromatherapy? So what are some other options out there for people who, because medications are they can be terrifying, and I think that does block a lot of people. Even like this past year has been extremely stressful for myself and my husband. I actually lost a friend to suicide a few months ago, and it's very stressful, and even we started doing a lot of aromatherapy, you know, not knowing what we're
Right.
doing.
Mhm.
Right.
And I put it on last night when I was getting into bed, and I was like, oh, I just feel so much
Much
better
better.
right now.
Yeah.
And no medication would do that, I don't think.
Yeah.
Absolutely. Yeah. And you want to answer first? Ma'am?
Well,
Like-
well, just by Olmsted County's report, the statistics from 2016, people who, especially age 65 and above, a lot of them take more than 5 medications. And you're thinking about when they are taking the medications, there are a lot of side effect. The side effect is triggered from a medication you take, and so think about the chain of a reaction. 5 medications. There are so many side effects, and you don't feel well, and it's just a kind of a bad cycle again and again. So Rochester Clinic's approach, the team's approach is when patients come to us and we basically ask them, what is your goal? If they want to feel well, they just don't want to stick. They just don't. They are looking for more options other than the medications. Then our physician will work with the patient and ask about their lifestyle habit, and we coach them starting from, or maybe you start eating more whole food, plant-based, and if you feel better, you can do more activities such as walk more. Because when anybody is so heavy and have a joint pain, they don't feel well, it is hard to push them to exercise or be on the treadmill. And so that is the trouble, that when people being told by their physician and say, well, you need to exercise more. Of course I know, but how? Because I have a joint pain. So we normally coach people, help them improve their diet. And secondly, they need to feel good about themselves. They're confident, and that's where it comes from. The the aromatherapy, if that's an option, to help them feel better and to lift up the mood.
Mhm.
Yeah.
Absolutely, and the beautiful thing about the aromatherapy is it's an integrative approach, complementary approach. So if you are having medical care, or you're taking medications or whatever, that's fine, because we will be able to just complement what we're doing, what you're using. And it's also an option for, and like you said, to experience that emotional elevation, becoming more confident, overcoming those mental barriers and obstacles. And that's why it's so good in the workplace. I use it, I'm an entrepreneur, I use it at home all the time. And that really helps me get when I'm in those slumps and I need to get myself out. I am using my aromatherapy. Different methods that I use and practice, which I encourage others to use too. So aromatherapy works along with what they're doing at the Rochester Clinic, along with the lifestyle medicine and the physicians. And I do classes there as well. So we just did a program on stress management, stress detox, going through the mind, going through the heart, physical, environmental, as well as life balance, and really building that awareness of what's stressing. And as soon as you feel it, you know it, and you're able to tackle it before it becomes a chronic issue. So that's where absolutely the aromatherapy, mental, physical, it's a holistic approach. So anybody who would come to the clinic or speak to me at the clinic would be experiencing a holistic approach. It's eating, diet, sleep, the whole 9 yards. So we're including all of that in the aromatherapy.
Another thing is we look at the root cause. We don't want to put a band-aid.
Absolutely.
So, for example, anybody has a knee joint pain, well, you don't just give them an injection and say, done, you come back in 3 months. Our podiatrists will help the patient take a look at the joint, through the x-ray, and see whether there's anything need to be corrected, and then we'll, suggest to consult with our physician whether there's any lifestyle can be changed, because if you shave a couple pounds, will reduce the burden on your joint, you definitely will feel much better. Also, the harmful food intake into your body actually increase the inflammation, and that's why we need to clean up our body to give our body a chance to recover. So that's how we help patients to feel better. It's a very organic way. And it is not like a Band-Aid,
Yeah.
you put a temporary Band-Aid.
And you can, and I'll say this to be honest, you can use aromatherapy as a Band-Aid. You really do need to get to root cause. So if there is that joint pain and there is discomfort there, sure, I can put together a formulation to help with that discomfort, but I will be no different than popping a pill, except it's natural. It's not going to have that harm on the body, so not quite the same, but we want to get to that root cause. So we will work together to reduce that discomfort as well as get to that knee where it needs to be, and as naturally as possible. And so that's really what we do. We try to work together to find, the best approach to getting you comfortable, feeling good, happy, and naturally. As natural as possible.
Yeah, and I think in a highly medical town, I think a lot of times we gear towards medication.
Sure.
And I'm a trained scientist, and it's aromatherapy just works. I mean, I was actually shocked last night when I just turned that on, and I'm like, I'm asleep now. Like it was just like an instant. So, I think in our town, it's a little bit of an extra fight that you might not have in other places,
Right.
because it's, we're like medicine.
Right.
But
yeah, it is more open. Actually, I have been on another lifestyle medicine podcast. I listened to Dr. Joe Kahn's podcast, and he mentioned about the aromatherapy is one of the alternatives to help you relieve the stress. And that actually good for your heart too, and your mental wellness. This is all connected together. Also, Dr. Neil Nelly, our guest speaker, he also uses some of the aromatherapy to help his patient to reduce the anxiety and depression. So I cannot wait to meet with him. This is all connect together.
Yeah, absolutely. And there are so many scientific journals, medical journals as well, about how aromatherapy has been used in clinic. The science behind it, we could have a conversation off the video, but the short of it is it works so well with the brain because of our olfactory receptors and the chemical constituents in each of the oils. So when it reacts with your brain, it's working with your limbic system. So it's supporting your emotions. So when we are inhaling it and we're allowing that essential oil to work with our brain, that's why we're able to overcome those obstacles, we're able to relax, we're able to sleep. It has a direct connection with our central nervous system. So it helps to calm us down. And then on another note, it can help to energize us. So that's just the mental side of it. That's not even including the physical, but that's just a little piece to how the chemistry of the essential oils work with our body. And of course, it works differently for everybody. So
yeah, no, that is very cool.
Yeah, it is fascinating.
I think it's it's so amazing. I mean, it's when you break it down, the aromatherapy, the essential oils, they're natural ingredients that all of health was based on at one point.
Yes,
Now, getting back to that. So I will wrap up by asking for any final thoughts, and then if you want to repeat again how people get tickets.
Okay. Well, Lotus Health Foundation, the reason behind this name is Lotus actually rooted and grow from mud. And it will arise above the mud to bloom as a beautiful, elegant flower. And it's just the murky mud actually a symbol of the unhealthy lifestyle, such as the stress, fast food, or the junk food. So our purpose here is to help the people live up above the current murky bad lifestyle choices and to become another beautiful lotus. And hopefully not very long we can help so many lotus to grow and to become a community of lotus. I cannot emphasize more enough. We put on all the effort to invite the national guest speaker come to speak to our community, general public, and also physicians if anyone who is a full-time student or has a financial hardship, please contact me. We do have a certain amount of the scholarship donated by a corporate, Magnolia Steel. They support us to promote this education. So call me for the discounted rate, and we want you to get well. And you can go on to our website, lotushealthfoundation.org or rochesterclinic.com under the 2019 Community of Wellness event, and you simply click on the registration for the symposium or the registration for gala event. If you have any problem, please call 507-218-3095. Contact me. I will help you go through that.
Awesome. Well, thank you.
Thank
Wrap up
you.
here.
Thank you very much.